Hi, I'm Mike Wang from the University of Miami. I'm a neurosurgeon.
Hi, I'm Mike Steinmetz from the Cleveland Clinic, also a neurosurgeon. Welcome to Ask the Experts.
Mike, are you enjoying this NAS meeting 2018 in Los Angeles?
This has been a fantastic meeting. This is a great location. The meeting's been phenomenal. The scientific program's great. It's been wonderful.
You know, one of the things, I was walking through the exhibit hall and it really struck me. It seems like there's like a critical mass of robots now.
You know, I was thinking the same thing as you walk through or even talk to the industry reps. I think that, one of the major focus, or not the major focus on most of our industry sponsors, our partners, is robotics. What do you think about that? You think this is going to be the future of spine surgery? I mean, a lot of people are investing in it this way. Is this going to be where we're at?
Yeah, I mean,
5
you're
years,
right.
10 years from now?
There's a lot of investment. I mean, it certainly seems very appealing. Maybe we've finally reached that technological precipice where like it's possible, right? I don't really know. I think it's certainly there's energy on it, right?
Yeah, and it's interesting. I reflect back on spinal navigation or even use of like intraoperative O-arm and stealth. If you go back 10, 15 years ago, when we had one and it got used very little.
The Z-Cat.
The Z-Cat, right?
Yes, right.
Nobody wanted to use it, and now it seems like we don't have enough of them.
Yeah.
It seems like, and we have a lot of them. It seems like it has taken off and you almost becomes a normal part of the surgery that we do. It's so accepted now. And I wonder, we look 10 years out in the future, 15 years out in the future from now, will it just be a normal part of our operation to be doing this robotically? Or not?
How many robots did you count? Robot or robotic type of things did you count out there?
Well, at least 3. I think there's at least 3 mainstream robots that I can think of at the top of my head, and we both know companies that are developing them now. So, I think maybe the question for you is, how many robotic platforms do you think we'll have, in the next 5 years?
You're right. The 3 that are out there, imminently out there for screw placement, and I always think, of course, to the CyberKnife, which is a true robot. You just push a button and it does the work. That is a true robot. And then you think about all the visualization robots, right? The ones that are getting you to your exoscope or microscope to the position you want.
Right.
So you're getting orientation with nav and your visualization. Then I think about the passive robots like the arms, right?
Yeah.
That they don't do anything except they hold you.
They hold
there,
you where you're at. Yes.
right?
Yes.
I think it's really exciting. I think, but I personally face this in my institution, and I don't know how you do it at Cleveland Clinic. This issue of like the capital equipment.
Right. Right. Yeah. I mean, I think that's challenging. And so if you look at this as your CFO, you'll invest in new technologies which either can improve patient outcome or drive costs. And there's other reasons that they obviously look, and if you can add incremental cases. But when you look at a robotic platform today, at least in my opinion, the evidence that is in their white paper shows that it can lower your revision rate, decrease screw misplacement. But think about your own practice. How many cases of your own are you taking back to replace a misplaced screw? We looked at this ourselves. Mm-hmm. It's not that high, and our infection rate's really low. So it's hard for me right now to say that a robot is going to improve the outcomes of the surgery that I'm doing today. And so you're adding a lot of cost for something that may not improve a patient outcome today. And that's challenging, I think, on the purchasing side. Obviously, there's a marketing advantage to it, and you can add incremental case volume with them. So there is advantages, but I think there's challenges when you go to your CFO and say, I need $1 million plus for a piece of equipment. They say, well, how's this going to make you better? And if you can't show them that, they're a little bit hesitant to release that capital money.
I like how you bring up this issue of making it better, because I've always wondered, and I think the robots just get released as a technology, but there hasn't been a concerted effort to say that, for example, the robots make the best surgeons better,
right,
or the average surgeon really good, right, or and I hate to even say it like that, but the surgeon who's struggling, or maybe the older surgeon, much better than they currently are, right?
That's right. I think it's an interesting. Robots to me are an interesting concept with regards to surgery. So I think what it does is it takes a person who's technically not very good at doing surgery and makes them better. Because what I think this is going to do for spine is it's going to change our field, as you and I always talk about. It's a very physical medicine, right? We go in, we're bending rods, we're putting in screws. We oftentimes are thinking a little bit about the case, but we figure it out on the table of exactly what I need to do, where am I going to do an osteotomy. I think our cognition part, it's much more physical at times than cognitive. And I think what a robot is going to do is going to make spine surgery a much, much more cognitive science or field, where we're going to just think a lot about it, apply that to a simulator, which is going to be our robotic platform, and then the robot's going to help us actuate that. and technically there won't be a challenge to that, right? You can take someone who's never done spine surgery and have them put in 20 pedicle screws through a robot that you plan. They didn't plan them, and there's no challenge.
So
of doing
more
it
like a coach in a football player.
That's exactly
kind of thing,
right. Yeah, I think I think about it almost like our deep brain stimulator colleagues in neurosurgery, where the actual technical part of putting a stimulator in is actually really easy.
But they spend a lot of time thinking about
Well,
it,
let's
right?
not get on, on those guys
That's
about,
right.
yeah, because
But they spend a lot of time
yeah.
thinking about where they're going to put it and how do you target it and all this. It's much more cognitive. And I think spine, to some extent, not the whole field, but it's going to. I think we're moving in that direction.
More a thinker than a doer.
Yeah,
kind of thing,
if this robotic platform works, I mean, I think that's what it may do for us.
So you train a lot of residents and fellows like we do. I know it's very individual. Do your residents and fellows generally like the robot, or do they generally not like it?
Not like the robot, and it's simply because it's cumbersome, right? As we look at all new technologies, right now we're in the cumbersome, part of this where it's difficult, it's timely, it's in the way, and so and it's taking away from their ability to put in screws either with navigation or freehand. So I think that as a trainee, I don't think they appreciate that part of it. They want to do it more, more hands-on.
They're not old like us and getting arthritic.
Arthritis
right?
in the hands hasn't set in yet. But it's an interesting aspect of training, and you have published on this or presented on it at least, where you there's a learning curve to putting in screws and this sort of thing. And I think that this, to some extent, technically eliminates the learning curve. It puts it more in your brain and can you plan it, but actually putting in a screw safely with a robot, I mean, the robot can, if you can plan it right, you should be able to put it in. It's going to impact training.
Do you think that we're ever going to get a robot that's going to do a decompression for us? Because that seems to me like the big challenge. That's the heavy lift.
I think that it has to. I think we talked at the beginning about what's the future of robots. I think if we can't get beyond simply putting screws in, this platform will go away. It's got to get to a point where we can actually decompress the spine in a safe way. Either through a robot or an aid of a robot, can we safely remove bone, tumor, material around nerves, and just do it in a much, much safer way? And I think the answer is yes. Mm-hmm. I'm not sure how far away that will be till it's just mainstream in our hospital, but that will be a game changer, I think.
Great. Well, thank you for your time.
Thanks, Mike.